Welcome to This Week in Health IT News, where we look at the news which will impact health IT. My name is Bill Russell, Healthcare CIO Coach, creator of This Week in Health IT, a set of podcast videos, collaboration events dedicated to developing the next generation of health leaders. This week, I'm doing a series of interviews with health system executives and consultants and others who are talking about COVID-19 preparedness. If your system has a best practice to share, please shoot me a note, bill@thisweekinhealthit.com, and we'll do a 10 to 15 minute Zoom recording like this one to capture some of your thoughts to share with the industry. I want to thank Sirius Healthcare, who reached out to me last week and asked if they could sponsor a series of conversations to help the industry prepare and celebrate the great work that Health IT is doing right now. I appreciate their foresight and their commitment to the industry that they serve. Today's conversation is with David Chou. Good morning, David, and welcome to the show.
Thanks for having me. Excited to be here. Always looking forward to chatting with you, Bill.
Yeah, I'm looking forward to it as well. I know you're extremely well connected. Hey, what are you doing right now? I just want to get that out there. People ask me, it's like, what's David doing? So what is your role and where are you spending a majority of your time?
Yeah, I have the luxury of playing two roles. First role is I'm the CIO for Luye Medical Group, which is based out of Singapore, and they have 50 plus sites throughout Australia, Singapore, and China, specifically in Shanghai. And we're building out 2 Cleveland Clinic facilities in Shanghai. So part of my time is working on that. And the other part of my time, I get to be advisor for various Fortune 500 companies, also advising various health systems on their go-to-market strategy. So I get to play both a vendor space and a decision maker.
Wow. So I assume those building projects and other things have slowed down during this time in overseas.
So here's what's funny. I saw what we're experiencing right now 2 months ago. I saw the lockdown from my peers in Shanghai. I saw how their lives were affected. And now fast forward 2 months later, we're going through that in the US. But now looking back as far as how the lockdown worked, the lives are actually going back to normal in Shanghai. Just talking to a few of my colleagues last night, this past week has been the first time they've been able to go out for dinners. Restaurants are opening back up. Traffic is starting to get hectic in Shanghai. So things are picking up, and which is a good part. So I am extremely optimistic as far as to the plan that we're facing and we're going through in the US. And hopefully we stick to that. Hopefully we have some ways of just improving and finding some vaccination just to prevent the virus from really spreading even further.
Yeah, and David, thanks for taking some time to meet with us. I really do appreciate it. The first question in this is pretty general, and then we'll dive into the health IT stuff. What are some things that you're seeing health systems doing to handle the COVID-19 pandemic in their communities?
Yeah, I'm seeing a lot of various things. First is the key is to identify and quarantine. So you're seeing lots of tents being set up. You're seeing hospitals that are now being designated as a COVID hospital. I just saw this news from Stewart Healthcare where they have designated a COVID hospital. And here's the interesting part. When I just tweeted about this yesterday. The last few months helping the Shanghai project, we were going to build this new hospital with a fever clinic. I mean, a whole dedicated space dedicated to quarantine patients coming in with a fever. And I thought that was the most ridiculous idea. Now, fast forward 2 months later, probably one of the things that we need to do, because this virus situation can be an ongoing situation that we have to face in health systems. So you do need to find ways to quarantine. So as we've seen these tentative facilities that are being set up throughout various health systems, it may be something to think about moving forward. But that's from a health system perspective, that is happening. They're trying to figure out how to quarantine, how to isolate, and really take care of the most sickest patients as soon as possible.
Yeah, it's interesting. The information's coming at us faster than I think any of us really anticipated. And just the information you get today will change how you talk and think about it tomorrow. And, sort of a whole wing for isolation and whatnot. Just a month ago, you just would have scratched your head and said, that's a waste of space. And today you're sitting there going, wow, what foresight, how smart were we to be thinking about it? I mean, things really have changed. It'll be interesting to see, what happens going forward. Do you think, I'm going to already change the format, but do you think we are moving at a pace in health IT that's pretty unprecedented. I don't remember us moving at this pace. I'm hearing people scale up their telehealth, threefold, and their VDI environments fivefold, and in time frames that we never would have operated in before. Do you think this will change how we operate in health IT?
Definitely. If you look at the future of work, that is definitely going to change. Imagine 3 to 4 months from now telling your workforce to go back to the office where they have just adjusted to life of working remotely. For myself, I love it personally. I don't know how I could ever go back to a 8 to 5 sitting environment. It's going to be very tough, and it'll be a big adjustment. So I do foresee that changing. I do foresee some benefits too. Hospital space are at a premium, right? The cost of the space in hospitals. So now if you're have this remote workforce, utilize that space for something that can provide care rather than administrative staff. But here's the good part for health IT. I think some of the things that we're implementing now, whether it's telemedicine, VDI, virtual desktop, things to scale out, it's been on the top of mind for CIOs for quite some time, but we have been struggling to get whether it's getting the budget or getting the resources to dedicate to that initiative. Unfortunately, it had to take crisis to move at a rapid pace, but I do foresee this being the future. I do foresee VDI or desktop as a service being a standard. I do foresee telemedicine playing a bigger role in terms of providing care. It has always traditionally been just a piece of care in a silo, but now telemedicine can be part of care delivery. And that is a big positive because that's what patients, consumers have been expecting. And we as health systems have sort of failed to deliver that.
So let's talk health IT at this point. You're doing some work and you have some clients that you're coaching around this. What are some things health systems are doing? I mean, the telehealth and the VDI are probably the two most that people have talked about. But what are some maybe some of those things? What are some practices they're doing, and maybe what are some other things they're doing to handle the requests that are coming from the organization and from the community?
Yeah, so let's look at just the virtual desktop experience. I think right now people are either patching what they already have or trying to figure out how to create more connectivity. But there's a fundamental challenge right now. A lot of organizations' foundational infrastructure are not up to date. So number one, hopefully they're taking the time to understand that they need to upgrade their infrastructure at a core level, the blocking and tackling. So that needs to happen. And then number two, start thinking about how you scale fast. How do you do it with agility? So rather than deploying services, or even I'll use desktops, whether it takes a few weeks or even a few months from procurement to delivery, now think about how you can deliver in a matter of minutes and seconds. So that's a very different mind shift. You have to also retrain your engineers rather than move them from being traditional network engineers. They probably have to become cloud engineers. Very new skill set and requires a new culture, requires a lot of retraining. So that definitely needs to happen. So I'm seeing the shuffle and the scrambling for executives now where they have to scale up faster and the speed that they have never experienced before, but they do understand how it works conceptually. Now it's really operationally, how do they drive that? And secondly, I think they have to understand how to take advantage of partners, because you cannot build things yourself anymore. Traditional hospital systems are not development shops. They don't act as a vendor. So start thinking about how you can partner. I think that's going to be a really critical task, and that's going to be a very big experience and change for a lot of healthcare decision makers.
It's so two things I do want to talk VDI in a little more detail with you if we can. And then the second is I want to talk about outsourcing. So there's organizations that have outsourced, and I want to sort of touch on that. And I haven't been able to touch on it with health systems. And so it's great to have these conversations with people who operate in advisory capacity, because we can get into some of the pros and cons of outsourcing. But VDI. So for us, we had 6,500 VDI workstations when I left St. Joe's, and the first thing was to get that first rack going. Well, that was a Herculean task because we had a couple hundred applications we had to get to work effectively on Citrix, not the least of which was the Imprivata, and we had to get Nuance, we had to get Dragon working on it, and all these things back in the day. These were early on in the environments. We had to work very closely with the vendors to get it working really well. And then we got it working in one box. And we made the mistake of thinking, oh, great, we'll just stand up a bunch of other boxes and we'll get up to 6,500. But scaling is a different beast. I really didn't anticipate how many challenges we'd have to scale to 6,500 from a single centralized cloud data center. And but you have these things like a whole bunch of workers logging in at the same time, and bandwidth. And people a lot of times mistake bandwidth and latency, and they both create different challenges. And bandwidth doesn't necessarily alleviate latency. You've got to address latency in and of itself. And and I'm a former CTO, and so even I was kind of surprised with the number of challenges we had to scale it out to 6,500. Is that going to even be possible for some of these environments? I mean, you're in a crisis mode right now. If they don't have it really thought out ahead of time, are they going to be able to scale this up that rapidly?
Yeah, I think what you described is going to be a very difficult challenge, because most folks are just thinking about plugging a hole, right? They're just thinking about how to provide the infrastructure to their resources. So they're probably buying the biggest bandwidth that they can and just deploying it. I think as post-COVID comes, we need to really get a lot smarter. We need to probably think about the different tiers of in terms of the environment. For example, you could probably use a lot of the public cloud providers for your day-to-day commodity-like environment, where you can scale up and down relatively quickly without a lot of complexity, a lot of legacy applications that may not work. You could probably just put it up in the public cloud infrastructure and deploy that. Where the challenge comes in, as you had just talked about, is some of these traditional healthcare enterprise vendors who are not cloud ready. They're running on legacy code, and it's very difficult to do and deploy in a virtual desktop environment. So you probably need to sort through the portfolio and have a few different tiers in terms of your virtual desktop infrastructure environment. That's how I would be thinking about it. And that's the only way you can scale out quickly. But you won't have a one-fit solution for everything. But with the multi-tier strategy, you could probably get through that and scale out as fast as you can moving forward in the future.
You know, it's interesting. I was chatting with somebody who recently outsourced, and they said we didn't anticipate this. Like we didn't anticipate crisis, because really why you outsource is to reduce costs and hopefully get some skills that you didn't normally have, so that you can really address this. You can address these kinds of scale challenges, but you expect the scale challenges to happen over a longer period of time. What are you telling your clients that maybe have outsourced and find themselves sort of with a lack of agility right now that they thought they were actually increasing with the outsource?
Outsourcing doesn't mean that you can just shift the risk to a third party, right? I think you're outsourcing because you understand the capacity needs. You also be able to have a bigger pool of talent that you may not be able to recruit or build internally, but you still have to manage them. So my tip for outsourcing is you treat this as your internal staff. You have to figure out how to manage them the same way, but now you have a bigger pool of talent and a company that's standing behind you with faster innovation, go-to-market strategies, and hopefully better technology. But here's the big challenge in healthcare and hospital systems that we don't talk about. These academic medical centers, hospital systems are typically the largest employers. When you outsource and shift that workforce to a third party, it has a big hit on the city's GDP, the economic growth. So you have to figure out how to balance that. And that's the unspoken area that makes it very hard in healthcare to take advantage of outsourced and managed services, because you're a big economic driver. There's a bigger impact from outsourcing that you would probably not have in other industries. So that's the biggest challenge from a political aspect. But that's something I would say the CIO, the executive team needs to think through and think about how you could take advantage of the current workforce in a managed service environment.
All right, closing question. Your mind is about 2 months ahead of us on this, since you've been dealing with it with the hospitals that you're working with in Singapore and Shanghai. So, what are some things we should be thinking about from, let's stick with health IT, because that's our area of expertise. So what are some things we should be thinking about from a health IT standpoint for how this is going to play out maybe over a month, 2 months, 3 months for us and our staff?
For the last few years, I think you and I have been on the same page in terms of we have to build on top of platforms. You can't just buy enterprise apps and stick them together. I think now, as people are starting to understand, you have to be able to build on a solid platform, whether it's a telemedicine platform, BDI platform. You need to have that solid foundation. So think about how you could build platforms so that when it comes to another crisis, hopefully it won't happen again, you can scale a lot quicker. So get into platform development, get into platform thinking, and that's going to be a really big shift. As we move towards cloud environments, it's not about just utilizing one cloud. You're gonna have to figure out how to deal with cloud to cloud integration, which is gonna be the future. So having a solid platform to help you through that is gonna be the key and a big difference. So that's my advice. There's obviously a lot of details in terms of what we talk about when it comes to platform, but buying a technology that you could rely on, develop on top of, and make sure they're a solid partner is gonna be the key to the future.
We are simpatico in mindset on that. Platforms and multi-cloud are the future here. A lot of different nuances of how to implement that and how to make that happen. And there's a lot of great tools to make that happen. David, thanks for taking the time. Just real quick, how can people follow you, keep up to date on what you're doing?
Yeah, I'm a big user of Twitter, so follow me at DCHOU1107 and also LinkedIn. I think those are my two go-to platforms right now in terms of sharing content and ideas. So happy to do whatever I can for the community.
Well, I appreciate it. And at some point when this thing calms down, you're gonna have to teach me how to use Twitter. I figured out LinkedIn, but gosh, Twitter still escapes me. Who knows? Thanks again. Special thanks to our sponsors, VMware, Servers Advisors, Galen Healthcare, HealthWorks, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com, and the YouTube channel. If you want to support the show, the best way to do it, share it with a peer. However you do that, send them an email, support our posts on social media, however you normally do that, just do that. We'll be back again on Friday, and we'll continue to do more of these interviews over the next couple of weeks. Thanks for listening. That's all for now.